Hello, my name is Freya O'Keefe, and welcome to my presentation on exploring technology in healthcare with artificial intelligence. For this project, I chose Google Gemini. The main reason I chose it was for convenience. I use Google for pretty much everything, email, GPS, etc. So it seemed like the most appropriate choice for me. Also, the interface seemed pretty user-friendly and aesthetically pleasing, which for me is a big deal. So the purpose of this project was to see if Google Gemini would give consistent and reliable answers when asked the same question multiple times. So for my question, I chose, what is the proper treatment for an adolescent patient diagnosed with schizophrenia? I asked the exact same question 3 times, and the goal was to test for accuracy and consistency in each answer. So for the first response, we'll go into that in a second, but basically it emphasized early intervention, recommended second-generation antipsychotics such as risperidone and aripiprazole, and included cognitive behavioral therapy, family therapy, social skills training, and it was basically a balanced approach of medication and psychosocial support. So let's take a look. So I did also try to see if I could get the sources listed out, which it kind of did, but then I saw that there's this button. So we'll go over that in a second. But as far as the answer, it gave a pretty detailed overview. The treatment seems pretty comprehensive. It did recommend the second generation antipsychotics, and saying that they were preferred for initial treatment due to lower risk of side effects, such as movement-related side effects. It also talked about the importance of family therapy. So going down here, so cognitive remediation, cognitive behavioral therapy, psychoeducation, and family intervention. So it all seemed pretty comprehensive. Overall, feels very well organized and covered both the medical and emotional aspects. And then as far as the sources, everything seems pretty legit, like Mayo Clinic, National Institutes of Health. I'm not really sure about this Mind one. I've never really heard of that before, but the NCBI, Oxford University, let's see, Online Journal of Issues in Nursing, Mount Sinai, so WebMD. But overall, for the most part, the resources seem pretty reliable. I did notice that there's not really any peer-reviewed journals or anything, so I don't know that I would use it for research, but just to get an overall view of the illness, it seems to work. So let's head back to the presentation and we'll go to the second. Okay. So the second response was honestly pretty consistent with the first one. It also mentioned long-acting injectables, though, to help with adherence, and then included the use of adjunct medications like antidepressants, anti-anxiety meds, stuff like that. And then it also stressed school support, case management, and healthy lifestyle, which the other one also mentioned lifestyle changes, but this one kind of goes into more detail. So let's click on that one. So down here, you can see, where is it? Okay. So yeah, the long-acting injectable medications, the adjunct medications, anti-anxiety, mood stabilizers, anticholinergics, and then here we go. Yep. Talks about the importance of family therapy, cognitive behavioral therapy, social skills training, early intervention, to improve long-term outcomes. Overall, once again, this one seems pretty well organized and covered both medical and emotional aspects of care. This one just seems to go a little bit more into detail about all of that. And then once again, as far as the sources, it's honestly all pretty much the same. So maybe adding a couple other ones. And Vancouver. So it just seems to go in a little bit more detail, which each time, honestly, it pretty much gave the same answer, just with more detail. So let's go back. All right, so the third response, repeated core treatment plan, just added more detail, like I said, for monitoring side effects as far as weight gain and labs. Mentioned ECT also as a last resort, and then focused on individualized and long-term care. So we can go over to that one. Okay. So here we go. We've got actual list of medications, talking about each individual one, and then going to the long-acting injectables once again, monitoring as far as side effects. So monitoring for side effects including weight, blood pressure, fasting glucose, fasting lipids. A lot of these meds can cause significant weight gain, so it does mention that as well. It honestly seems pretty consistent. It repeated a lot of key points, but it just seemed to go in a little bit more detail. One thing that stood out for me the most was the going into detail about the side effects. None of the other ones seem to do that. And then also the mention of ECT. So in rare cases or severe cases, it did mention that. And then it mentioned that treatment should be long-term and requires ongoing management. So that was probably the main difference as well. And then as far as the sources, once again, pretty much the same. It does look like we might have one. Yeah, so we've got one journal or essay. And it's the only one that I can really see in here. So that's one change too. All the rest of them pretty much seem the same. So comparing the responses, a lot of similarities. Medication and therapy was a foundation. Importance of early intervention, family and school involvement. The differences was more detail about the medications and monitoring, and then more detail about the different therapies and including the ECT. So it really was just varying levels of detail. Other than that, the content was pretty much the same. As far as reliability, based on these answers, I think Google Gemini is a reliable tool for general clinical information, for patients if they wanted to get a kind of overview and learn a little more about their illness or what they were diagnosed with. But for healthcare professionals, I think it would be a good starting point. But I don't think it would be good to replace clinical judgment. One thing too, though, I do think it might be a little too technical or confusing for patients as far, like it seemed like a data dump, like it might be too overwhelming. I wonder, and I didn't try this, but I guess I could, to see if you could like have them simplify it. So let's see. Simplify this response. spell it right first. That might help. Okay. Yeah, that seems to help. So you could, oh, there we go. Yeah. So that does shorten it a bit, makes it a little simpler. I think it might make it a little easier for patients to understand. So that might be good then. So it could probably help support care, but I should obviously never replace professional advice. So they should still see their doctor, but that would be a good way to like just learn new information. All right. So next, AI in nursing practice. I would say after this, my AI skills are improving. It's fairly new, so I know a lot more people are using it. I have a lot of friends that use it in their work. But obviously, for nursing, that's a little trickier. I feel like I could become comfortable using tools like this for research and brainstorming, stuff like that. And then as a nurse practitioner, I could use AI to help with patient education, documentation, maybe creating educational materials. But I've seen a lot of the AI like pictures and like graphs that they make, and it's all kind of a mess. Like they don't put real words. So I don't know about that kind of thing. I don't know about like creating those types of educational materials. But as far as just pulling up information, this would be a useful tool. I'd always make sure to double check the info and make sure it fits the patient's needs, though. AI definitely seems to be helpful, but it should for sure support and not replace our role. And as far as Gemini as a whole, or just AI as a whole, in this experience, it showed me that Google Gemini does give an accurate and consistent answer to each question. So the information seems pretty consistent. But no matter how smart AI gets, it definitely cannot replace the compassion and personal connection that nurses bring to the care team. So thank you for watching my video, and let me know what you think.